Hello, this is Chris Linenberger with the Texas Homeless Network. This recording is for the SOAR Fundamentals training presented by Texas Homeless Network and by other coalitions within Texas. This training is to review the fundamentals of SOAR. I will present an agenda in a few minutes. Many of you that are listening to this recording are going to be in communities throughout the state, and we'll be listening to it for your portion of the half-day training. Texas Homeless Network is a nonprofit membership-based organization that provides solutions to ending homelessness in Texas communities through education, resources, and advocacy. If you'd like to know more about what we do, the resources that we offer, and the trainings that we offer, please visit thn.org for more information. As I do introductions, I want to introduce the whole team, some which might be in the room with you, some which will not be. So the first and primary introduction would be your community lead. At this time, we have 16 community leads throughout the state of Texas, and I am working on providing more for communities out there. Your community lead should be in the room with you and should actually have helped coordinate this meeting specifically. The community lead is responsible for organizing trainings within the communities and for answering brief questions around SOAR. Next, we have the THN State Lead, which is Chris Linenberger, myself. My job is to develop and implement SOAR programs throughout the state of Texas and as many coalitions, homeless coalitions, and COCs as we can. The principle of this work is that the bigger network that we have for SOAR will mean the more resources that we will have. This is done by communities contacting and communicating with one another. Third is our PRA, PRA, which stands for Policy Research Associates Lead, who is Pam Hine. PRA effectively serves as the SAMHSA contact. So SAMHSA being the agency that developed this curriculum. Pam is located in Chicago and New Jersey, and she is responsible for coordinating through multiple states. Also, if I have any questions on the state level, I typically pass information up through her. Her information will be distributed at the end of this webinar. Then we have the local SSA lead. This would be the individual that hopefully is sitting in the room with you. This individual is working in your local Social Security office and is your main point of contact as you initially start applications through the SOAR process until the application is handed down to DDS in Austin. This local advocate, this SSA lead, is going to be your champion, and it's going to be the one that will be able to answer a majority of your questions. If they cannot answer your questions, then we do have state DDS leads. So our state lead for the SOAR project in Unit 22 is Lisa Martin, who heads up that unit. She is responsible for receiving SOAR applications in Austin, Texas, so that getting those applications out to her staff that will make the disability determination for each client. She is contactable through phone, and I will her phone information will be handed out at a later time through your community SOAR lead. So that is a brief introduction. I wanted to welcome you guys to this training. We are excited about doing these pre-recorded online trainings, which will be coupled with some live trainings or live structures during the training, during your half-day training in your community. So SOAR, Just kind of going through it. SOAR stands for SSI, SSDI, Outreach, Access, and Recovery. SOAR focuses on people who are homeless or at risk for being homeless. So this specific curriculum is developed for clients that either have no housing or that are in a program and supplied housing through this program. The reason why we can use SOAR for these individuals that are at risk of being homeless, that are in a program, is because they could break placement and break out of that that agency or that program, and therefore we need to make sure that they are secured. Also, this curriculum is sponsored by SAMHSA, the Substance Abuse and Mental Health Services Administration, in collaboration with SSA, and has been developed, or was developed and has been implemented since 2005. Right now, all 50 states currently participate in SOAR. However, no direct funding is provided to any of the states. This currently is a piece that it makes the rollout a little more difficult. However, we have some good systems in our state of Texas to be able to address this. So why is SSI, SSDI important for individuals? SSA disability benefits can provide access to, of course, income, housing, health insurance, treatment, and other supportive services, especially around income and housing. Under THN's project of Keep Texas Housed, we are very focused on getting our clients housed as quickly as possible. We realize that if we can keep them housed, then we can wrap other services around them. We know where, then that way the case managers know where to find them. We can get them stable. Stability is the key. We also know that for people with disabilities, so SSI and SSDI, this can be a critical step towards ending homelessness and promoting recovery. We want to make sure we really wrap these services around individuals that meet this disability requirement. So why is it important why is access to SSI and SSDI important for states and localities? People experiencing homelessness are frequent users of expensive, uncompensated health care, of course, bouncing from ER to ER or within the jail system. That can be very expensive for communities. So this really is an answer to lowering those costs. Also, communities can recoup some of their care from Medicaid for up to 90 days. Medicaid can do retroactive payments for 90 days of it from the SSI eligibility. And so that's really great for medical institutions and other institutions so they can get recuperative payments. Also, SSI and SSDI and Medicaid can bring federal dollars into states and localities and through community programs. In many situations, we know that our community programs are stressed, that funding is low, especially when working with this population, and this really helps us to bring in other resources to combat this and keep individuals housed and get them stable. So some information I was able to pull out for 2015 outcomes. So this is nationwide, of course. Initial applications. So there were specifically 3,971 initial applications, and with a 64% approval rate. And that is an average of 81 days to decision. So that's for initial applications. Around appeals, there was approximately 698 approvals on appeals. That's a 52% approval rate. And then that, of course, is a 82 average days to decision. So these are all great stats. In Texas, we are shooting to be up around the 70% mark on our initial applications for approval rate. We are on our way there at I believe right now about 67%. So we are on our way, and then of course getting the number of approvals up is important to us as well. Per the state of Texas, our average days to decision is a little bit higher. Right now for 2015, I believe if our memory serves, we're at about 129 days. So that is high, of course not as high as the typical year that it can take to get a decision, but it is higher than the 81 days. This specifically, we believe, is due to the fact that last year in 2015 we brought on many new communities, and so with those communities coming on board and doing initial applications, it does kick up your average days to decision. So around cumulative outcomes for SOAR. So since 2006, there have been 27,226 applications, SSI, SSDI applications that have been processed for clients, and that is with a 65% approval rate, which is really great. And then we know that approximately about 31,000 individuals have gained access to Social Security benefits using the SOAR program. So this includes, the reason why that number is higher, of course, is it includes the initial applications and the appeals combined. So this is really great news that by using SOAR, we are able to get programs running in our communities that can successfully house clients and get them the resources they need to help with their copability and to help with their disability. So when talking about those stats, of course, we have the top 8 states that are represented. And then in last year, those top 8 states had served approximately about 4,000 people. They have about an 89% approval rate on initial applications, which is wonderful. And then they have also proven that approval rates are the highest in places where more SOAR critical components are implemented. So the more of those critical components that we can get implemented, the better. And so we strive in Texas to be able to implement those as much as possible. So a little bit of information about the SOAR Technical Assistance Center. So of course I mentioned that THN is the state lead for SOAR. Well, PRA does all the technical assistance and runs the Technical Assistance Center. So SAMHSA actually funds this the SOAR TA Center to support the states and communities. The TA Center offers virtual and on-site technical assistance if you were to need technical assistance. SOAR TA liaisons are responsible for SOAR in multiple states. So as I mentioned before, Pam Hine, who is responsible for implementing SOAR and helping with SOAR TA in multiple states. And then also getting to know your TA liaison is great on the state level and on the community level. Lots of great advice through those TA center representatives and reaching out to really help answer questions in any aspect of SOAR. The case here is we really want agencies and communities to understand that as well as getting support from just THN, Texas Homeless Network, on the state level, which we are in the SOAR practices every day, we also, and you guys are also able to get technical assistance from PRA and from the TA Center. So it's good to know that these centers and these individuals are always there for you and can answer any questions that you have. So one of the activities through this training, this half-day training, that your lead that is with you in the room or your leader who's there with you in the room will go through with you is kind of why we are doing this work. So it's a really great activity, talking about the program for everything from ending homelessness to promoting recovery to transforming lives. What aspect do you love about this work? Why are you doing this work? And how is SOAR going to help you do this work? And then more so for you guys really to have the discussion about what brought you to this work. So if you've made time in your agenda to do that activity now, you can pause this this video, and you can do that activity now, or you can wait till after this presentation. All right, so a little bit about today's fundamentals agenda. We will be going, we did the basics, kind of running through what the basics of SOAR is about. And we'll do that in just a second. And then we're going to get into kind of getting started with an application. Who meets those SOAR requirements? How do we engage the applicant? You know, what is the SOAR state process like? And we'll review some forms as well. After that, we will do a refresher on the medical summary. And after the refresher on the medical summary, we'll get into tracking outcomes just briefly, special populations, appeals, and then kind of where to go from here. So we will step through all these pieces together. I want to remind many of you that are in the audience have already taken the online training and completed it, and that's great. And some of you have not. Some of you are in the middle of completing your online training. Some of you have just kind of briefly started the online training. So just a reminder that this really is a supplement training that should be viewed after you've walked through the entire training. It won't hurt to view it maybe in the beginning or middle of your training, but definitely when you enter the end of your training, go back and review this again, this webinar, or this online training. It'll really help you to see how SOAR is really linked in with other providers in your community. So let's go over the basics. So let's keep in mind that SOAR has broader goals than just delivering resources. We want SOAR to be that piece, kind of that binding piece for many of our homeless population that have disabilities. And this piece is really to help provide implements for housing, starting at the top, also going clockwise for access to treatment and other resources. So, you know, getting the resources for housing and then knowing that we can provide access to treatment. Also employment opportunities. You know, SSA is about not just getting people the benefits and being done with it. We really want to see people get back to work and to work at their capacity within their community, whatever that means. And so it can be a lengthy process, but it is one that is provided by SSA and provided through SOAR. So we really want to make sure that individuals you know, have a chance to get back to work and have some employment opportunities, because we know that is healthy for us to get back out in the communities. Also for community investment, meaning from the service providers and from the agencies that are out there, to be able to get individuals that are the frequent users of that uncompensated housing, you know, and healthcare, you know, the ER visits and the jail visits, to get people out of those resources and into a more stabilized housing resource. And then decreasing the adverse outcomes around that incarceration and hospitalization, making sure that the investment that we're putting in there, by building this system, we want to decrease those outcomes. So the partners for SOAR, of course, we bring on board, as I mentioned earlier, Social Security Administration. So they're the federal agency that administers SSI and SSDI. They also make the non-medical decision. So as many of you guys have learned by now, there is a medical and a non-medical decision that will be made, and SSA is the one that that makes that medical and non-medical decision. Secondly, we have the DDS, Disability Determination Services. They're the state agency under contract with SSA, and they actually make the medical disability determination. It is important to note that while SSA at the top is in your community and you know these people, and that's great, you can drive down to the office, DDS is not. DDS is located out of Austin, and all the paperwork will need to be sent to Austin through SSA. And so it's important to note that. Also, the other partners that we look to provide in, if we have not already, are medical treatment providers. and other medical and other treatment providers in your area. So providers that can help us do evaluations and assessments are just wonderful. Also, those medical providers that can help us track down and get a hold of medical records. So those three pieces, and then of course that last partner is you. And so the more individuals that we get trained correctly with SOAR and then know how to implement SOAR, the better. So we really want to make sure that we get individuals trained and that we get them linked up to these other partners in their communities. So some of the basics. SSI, of course, stands for Supplemental Security Income. So SSI is needs-based resource, and it follows the federal benefit rate. Now this federal benefit rate, because we're looking at this training staying up online for a while, we didn't want to put a number down. What you'll need to do is you can go to soarworks.org and you can look under there underneath SSI benefits, and they'll have posted the most recent benefit rate. You can also just put in supplemental security federal benefit rate in your Google, and you can use it that way. Around SSI, so SSDI, which is different than SSI. SSDI is Social Security Disability Insurance. So it truly is an insurance program. So it is a program that individual have paid into while they have worked through their 40 quarters, and that they can take money out of. And so, of course, this, because it is something that these individuals have paid into, the amount depends on their earnings that was put into the SSA system. So it just depends on what you put in as an employee. And then also, coupled with this, Medicare generally is provided at 2 years after eligibility for SSDI. So that's why it is really important for us to enroll individuals in SSI as quickly as possible. Get that piece started, roll it over to SSDI for their disability, and then within 2 years we can get them Medicare to cover them. Also, to remember that the disability determination process for both is the same. So meaning that the application is one and the same. They fill out the 8,000, go through SSI, and then it gets transferred down. Actually, I'm sorry. So you do the 8,000 SSI, and then when they qualify for that through your local SSA office, it will be determined if they make that, they reach that medical disability to get the SSDI benefits. So to review the application process, the application is initiated with SSA. So that is the first step, moving from left to right. And then SSA determines non-medical disability. So they will fill out and review all the information around your client for everything on that 8,000 form, which is marital status, which is residential status, which is all the specifics about your client. And then SSA transfers the claim to DDS. And DDS, remember, they're down in Austin, Disability Determination Services, they're the ones that make the medical eligibility. So they determine that, not SSA. And so DDS determines the medical eligibility, and then they return the record back to SSA, and then SSA notifies the applicant. So it's very important that you understand the structure and the process of this. So the pieces of criteria for eligibility are number one, medically determinable physical or mental impairment. So we have to show that the illness must either meet or be equivalent to the listing criteria that is used by DDS. And then the supporting information must be documented in their medical records. So that is primary. We have to make sure that the supporting information is there and that the listings are met. Second is the duration of this disability. So the impairment must be tied to an illness. It must have lasted or be expected to last for 12 months or more, or be expected to result in death. So the way we have to look at this, anything outside of a terminal illness or terminal illness has to be existing for at least a year or be expected to last more than a year. And then third and finally, the functional information. The functional information is the piece that is dwelled on by SOAR and through the medical summary report that really gets down to the the medical summary report and how those pieces work together. So what we have to do is that applicants must demonstrate that significant functional impairment related to illness exists that impede their ability to work. So what we're showing here specifically is that their illness is leading to their inability to work. And we have to show that through the medical records we collect, through the time that this client has had this disability, and showing that this illness does truly exist. A little bit of information about sequential evaluation. So through sequential evaluation is the process which DDS uses to make a determination. And so it's really important for you to understand these steps that can lead to your client being accepted or approved or denied for services. So if you see here, and you guys have hopefully seen this before, if you see here step one, DDS, after they receive the information from SSA, what they're looking at first is this individual, is your client working at and meeting SGA? So if you remember, SGA is substantial gainful activity. That actually is a dollar amount that is predetermined every year. And so that's an amount you will know, and it's a monthly amount. And DDS is looking at the fact of is SGA being met? If your client is working and achieving SGA, so if they're meeting that threshold, then they're going to get denied. DDS is not going to give them any more money based, above and beyond the money they're making. If they're making below that SGA level, then it's going to move to step two. In step two, DDS asks, does the person have a severe impairment? So this is where the medical documentation comes in. We're looking at if the medical documentation cannot prove that they have a medical impairment, they're going to be denied. However, we should be able to pull up records and show that yes, they have a medical impairment, and they will move to step three. Now remember, step three is very important because they can be approved at this time. It is our goal at THN to have all of our SOAR applications get approved at step three if at all possible. What we're asking here in step three is, does impairment meet or equal the listing? So the listing is the blue book listing of the impairment, and the blue book listing is very specific. It is not the same as the DSM. So what you really have to look at is you can look online at the blue book listing, and you can look, and we can speak to that when we are presenting the facts about our client's case. So if they meet the listing, then yes, the client can be approved for benefits right then and right there. If they do not meet the listings, so no, they would actually go into step four. Step four and step five get very subjective, but it's good for you to know these steps. So in step four, they're looking at, does the impairment allow for past relevant work? So they're really looking for, did your client do any kind of past relevant work that they might be able to do now? And if they can do that work now, they're going to get denied. However, if we're going to show that they can't do that work anymore, so no, they can't, then we move to step five, does the impairment allow for any other work? And so this is where a DDS would look at the red book, and they'll look at the list of occupations throughout in your area or kind of in your region is how they have that split up. And they're going to look at, can your client do any other work that is offered? It's important to stay away from this step because they're looking at it kind of regionally. And so we need to make sure that that we present the facts all up front. And then, of course, if they're denied, If they can do another kind of work, they're getting denied. If they can't do another kind of work, and if they can't show, DDS cannot show 3 instances where they could do other type of work, then they would get approved. So it's important for you guys to understand this sequential evaluation piece. So of course, just a reminder, step 3 again is key. The person can be found disabled at step 3 and can begin receiving benefits at that time. Second, if adequate evidence is presented that impairment meets the listing and the applicant is unable to do the work, then they can also get approved at that time. And then we want to make sure that we connect the functional limitations to their inability to do work with appropriate medical documentation. That is very important. Also documenting the disability, so making sure that as case managers we are collecting medical records from all treatment sources. We want to be able to get information from collateral resources, from common treatment centers, as many treatment sources as we can. So we really want to be kind of putting our fillers out there and finding out what treatment sources we can get information from. Also, we want to have 2 releases. So we want to have an agency release and the SSA 827 for each treatment source that are signed, and we want to make sure these are signed so that the case manager can start to share these records with SSA and DDS. Very important. So we want to make sure that we meet the listings, and also, if you can, organize your search. Do it methodically, and use some chronological order to go back through time. Call those treatment centers and gather those records. Very important stuff. Throughout this training, or throughout this brief webinar training, I will mention forms by their numbers, like that 827. You can always go to soarworks.org, and there's a list there of all the forms, and you can pull that information up there. So around documenting the disability, if medical records are not current, case managers may need to arrange for assessments to be done. This is really important. Also, mental health status exams must be done within 90 days of submitting an application. So DDS can require the applicant to get a diagnosis from a doctor, so a consultative exam from an MD, PhD. This has pros and cons, and I believe we'll talk a little bit about that later. But if we can find somebody in the community that can provide an assessment to be done that the client knows, then that is preferable. Or more preferable than that is really finding those and linking those medical records. And then, of course, making the link to work. So the question DDS is going to answer is, can the person work and earn SGA? We really have to be able to answer that question and present an answer to that question for DDS. So again, meeting the disability requirements in the listing, and then making that link between the person's illness and their inability to function within that work setting. So just knowing the client's history, knowing their that disability, whether it's a physical or mental health disability, and be able to follow that and use that to find the listings. So around functional information, for mental illness, the applicant must demonstrate functional impairments that meet the listings. So we want to make sure we document all 4 areas of functional limitations. This includes the activities of daily living, such as regular hygiene. Are they getting up on time? Not necessarily time, but the hygiene thereof and within their space. And then also social functioning. Are they able to go out and get on a bus? Are they okay in crowds? Can they talk with individuals, especially management, if they were to work or have tried working in the past? Third is the concentration, persistence, and pace. Can they focus on doing tasks for a little while? Do they get disrupted easily? Do they get off track? And then fourth is the repeated episodes of decompensation. So how often does your client fall back into an episode? How often do they go from a manic to depressive stage? What kind of what kind of cycle do they have around those kind of events. It's important to really note those. And then we must demonstrate the functional impairments in at least 2 of these areas marked above. So at a minimum 2 areas. If you can talk to more areas, that's great. But for now, we really want to focus on 2 areas at a time. So for functional information, for physical impairments, the application must demonstrate significant limitations in meeting physical, mental, sensory, or other requirements of work. And then also limit the ability to perform certain physical demands of work activities, such as sitting, standing, walking, lifting, or carrying. And this may reduce the person's ability to do past work or other work. So we have to show that those physical impairments really get in the way of the client to be able to do that work. That's what the functionality is getting down to, and the mental health impairments. So the Blue Book listing is right here. The website's at the top. For each Blue Book listing, what we have is a general description of the disorder. We have the Section A is the types of symptoms and impairments within the diagnosis. And then a Section B is the required level of severity or the limitations in functioning. So it really shows you the level of functioning or the limitations, so that client really knows, or so that you know what you're looking at functional wise. And then C is medically documented history, or longer, so for a longer period of documentation. So really to qualify, at the bottom we're looking at using A plus B. So if you have to, using A plus B, the symptoms and impairments and the severity of those. Or if you can just get C and you can find that medical documentation, that beats it all, and that is great. Criteria A, the Blue Book listings, of course we have to get information about these. You can pull out information from psychiatric evals, physical health evaluations, other neurological reports, laboratory results. Admission and discharge summaries are great. Also, diagnostic tests are great. So that's good to pull out information from all these pieces, as well as, and what's not mentioned here, is progress notes. So if you can really get a hold of some good progress notes, and you can show how your client struggles with day-to-day issues around his physical or mental health disability, that can be gold. Criteria B is the Blue Book listing. So we're looking at biopsychosocial evaluation reports, occupational therapy reports, vocational, psychiatric, functional descriptions, and medical summary reports, really any other reports that we can throw into it as well. So remember, here we're just trying to make the link. Part A plus Part B of those listings is what's going to show why the applicant is unable to work. And remember, the MSR helps to illustrate this and the connection, and that's where we really get to the summarization and the speaking parts of which. And A and B can equal that approval. That's really what we're after. So let's talk a little bit about co-occurring. Of course, substance abuse is deemed material with many of the disabilities that our clients have. And so we want to understand how material works. So if it is deemed material, and let me back up for a second. Co-occurring disorders, if they're deemed material, can lead to a denial, but they are not always deemed as material. So it's important to kind of know how this works. So substance is deemed as material when a person, if they were clean and sober, the functional impairment would not exist, or the person would not be disabled. So if your client was clean and sober and the disability went away, then the drinking, the disorder is considered material. So it's important to really show that maybe if we can find a time when your client was in a place, maybe a hospital or jail, where they could not get drugs or alcohol, that if they were there and yet the disability was there, still present in your client, this shows that it was non-material. So that's very important to show. Medical summary reports, just kind of a brief review. The medical summary report is a letter which describes the individual and his or her functional limitations and struggles. So also it supports the medical records submitted. It helps DDS see the person you're working with. It also illustrates the connection between the applicant's functional limitations and the impairment, and answers the questions of why the applicant can't work. So the medical summary report worksheet can help you start capturing all this information as a case manager, so you have it for you when you go to write the report. So use that worksheet. It can be found at soarworks.org. Also, that letter is submitted to DDS. So it's important that the medical summary report is two things. One is that it's very clear and concise, and that we really hone down to what is keeping our applicant from working and why this disability means that they can't work. And secondly, that we keep it as brief as possible. So about 2 to 3 pages is important. If we make it too long, then DDS can, when they get into reading it, it just can be too lengthy, and there might be some oversight and some stuff. So medical summary reports are considered medical evidence if they're signed by a treating physician or psychologist, so that's great. If we can get somebody to sign it, that's wonderful. But even without a physician's signature, it is important for DDS's determination of the applicant's ability to work if they have that information. So turn your MSR report in every time, no matter whether you have a physician's signature or not. But definitely, if you can get a signature, then that's great. All right. So we're going to stop here. So this was part 1 of this training. We will record a part 2, which will cover the first app and medical summary reports. So thank you for being online for this training. And you can take a quick break, possibly if you have any questions for the lead or trainer that's in your room. And then from here, we'll pick it up with the first application and medical summary reports. So thank you for being here.